Welcome back to our channel. Today we're diving into a topic that affects millions of people around the world, kidney stones. If you've ever experienced the pain of passing a kidney stone, you know just how debilitating it can be. But don't worry, we've got you covered. In this video, we'll explore everything you need to know about kidney stones. We'll break down what kidney stones are, the different types, and what causes them. More importantly, we'll share practical tips on how you can prevent and manage kidney stones right from the comfort of your home. From staying hydrated and making dietary adjustments, to recognizing the symptoms and using home remedies for pain relief. We've got all the information you need to tackle kidney stones head-on. Plus, we'll reveal some surprising myths and facts about kidney stones that you won't want to miss. So, whether you're looking to prevent kidney stones or need help managing them, stick around until the end. Don't forget to like, subscribe, and hit the bell icon for more health tips and advice. Let's get started on the path to a pain-free life. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. They can affect any part of your urinary tract, from your kidneys to your bladder. Often, stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stones can be quite painful, but they usually don't cause permanent damage if they're recognized in a timely manner. In this video, we'll cover everything you need to know about kidney stones, from causes and symptoms to treatment options and home remedies. What are kidney stones? Kidney stones, also known as renal calculi, are small, hard mineral deposits that form inside your kidneys. They develop when the minerals in your urine become very concentrated and crystallize. Did you know that there are different types of kidney stones? Let us review all of them together, because understanding the different types of kidney stones is essential for appropriate diagnoses and treatment. 1. Calcium stones. These are the most prevalent type of kidney stones, constituting approximately 80% of cases. They typically form when there is an excess of calcium in the urine, which combines with oxalate or phosphate to create calcium oxalate or calcium phosphate stones, respectively. Factors such as high dietary intake of oxalate-rich foods, like spinach and nuts, certain medical conditions such as hyperparathyroidism, and genetics can contribute to the formation of calcium stones. 2. Struvite stones. Struvite stones, also known as infection stones, often develop in individuals with urinary tract infections caused by certain bacteria. These stones are composed of magnesium, ammonium, and phosphate, and they can grow rapidly and become quite large. This type of stones are more common in women than in men, and may require intervention to prevent complications, such as kidney damage or recurrent infections. 3. Uric acid stones. It forms when there is an excessive concentration of uric acid in the urine, leading to the formation of crystals. These stones are more prevalent in individuals with conditions such as gout, which is characterized by high levels of uric acid in the blood. Dehydration, a diet high in purines found in red meat and shellfish, and certain medications can also contribute to the formation of uric acid stones. 4. Cystine stones. Cystine stones are rare and occur in individuals with cystinuria, a hereditary disorder characterized by impaired reabsorption of the amino acid cysteine in the kidneys. As a result, cysteine levels in the urine become elevated, leading to the formation of crystals that can grow into stones. Cystine stones are typically larger and more difficult to treat than other types of kidney stones, often requiring specialized medical management. Causes of kidney stones: dehydration, not drinking enough water. Diet: high intake of protein, sodium, and sugar. Obesity, high body mass index, BMI. Digestive diseases such as Crohn's disease. Medical conditions: hyperparathyroidism, certain urinary tract infections. Symptoms of kidney stones are with similarities with urinary tract infection. Severe pain in the side and back, below the ribs. The most telling symptom of a kidney stone is intense pain in the lower back and sides, often described as one of the most severe pains a person can experience. This pain, known as renal colic, usually starts suddenly and fluctuates in intensity. It occurs because the stone moves into the ureter, causing a blockage and increasing pressure in the kidney. Pain on urination. As the stone moves down the ureter closer to the bladder, you might experience sharp, stabbing pain when you urinate. This pain results from the stone irritating the delicate lining of the urinary tract, making urination an uncomfortable and sometimes excruciating process. Pink, red, or brown urine. The presence of a kidney stone can cause bleeding in the urinary tract, leading to discolored urine. Your urine might appear pink, red, or brown due to small amounts of blood being mixed in. This condition, known as hematuria, should always be checked by a healthcare provider, as it indicates that the stone is causing damage or irritation. Cloudy or foul-smelling urine. Kidney stones can sometimes cause urinary tract infections, UTIs. If this occurs, your urine may appear cloudy or have a strong, unpleasant odor. Cloudiness typically indicates the presence of pus, while the smell could be due to bacteria that have infected the urinary tract. Nausea and vomiting. The severe pain from kidney stones can trigger nausea and vomiting. This happens because the pain can stimulate the nerves connected to the gastrointestinal tract, causing these distressing symptoms. Nausea and vomiting are common reactions to intense pain and the body's stress response. Persistent need to urinate. If a kidney stone reaches the lower part of the urinary tract, it can cause irritation and a constant urge to urinate. You might find yourself needing to go to the bathroom more frequently, but often passing only small amounts of urine each time. Fever and chills if an infection is present. If the stone leads to an infection in the urinary tract, you may develop a fever and experience chills. This is a serious symptom and requires immediate medical attention. Fever and chills indicate that your body is fighting an infection, which can quickly become dangerous if left untreated. Recognizing these symptoms early can help you seek appropriate treatment and avoid complications associated with kidney stones. If you experience any of these symptoms, particularly severe pain, blood in your urine, or signs of infection, it's important to consult a healthcare professional promptly. Diagnosing kidney stones. Imaging tests, x-rays, Connecticut scans, or ultrasounds to locate the stone. Blood tests. To check for high levels of certain minerals. Urine tests. To check for signs of stone-forming minerals. Analysis of past stones. To determine the type of stone. Now let's talk about some treatment options for kidney stones. Medical treatment. Pain relief. Over-the-counter or prescription pain relievers. Pain management is crucial when dealing with kidney stones. Over-the-counter pain relievers such as ibuprofen, Advil, acetaminophen, Tylenol, or naproxen, Aleve, can help alleviate discomfort. For more severe pain, your doctor might prescribe stronger medications like narcotics. These medications do not treat the stones directly, but help manage the intense pain associated with passing them. Alpha blockers to relax the muscles in your ureter. Alpha blockers such as tamsulosin, Flomax, are medications that help relax the muscles in the ureter, the tube connecting the kidney to the bladder. This relaxation can make it easier for the kidney stones to pass through the ureter and out of the body. These medications can reduce pain and increase the likelihood of passing the stone without surgical intervention. Extracorporeal shockwave lithotripsy, ESWL. ESWL is a non-invasive procedure that uses sound waves to break kidney stones into smaller pieces that can be passed more easily through the urine. During the procedure, you lie on a soft cushion or water-filled bed, and a machine generates shockwaves directed at the kidney stones. This treatment is typically used for stones that are too large to pass naturally, but are still small enough to be broken into passable fragments. Surgery for larger stones. In cases where kidney stones are too large to be passed naturally or cannot be broken down by ESWL, surgical intervention may be necessary. One common surgical method is percutaneous nephrolithotomy, PCNL, where a small incision is made in the back to directly remove the stones from the kidney. This procedure is often used for very large stones or stones, causing significant obstruction and infection. Ureteroscopy, a thin scope to remove or break up stones. Ureteroscopy involves inserting a thin, flexible scope, ureteroscope, through the urethra and bladder into the ureter to locate and remove or break up stones. The ureteroscope allows the surgeon to see the stones and use small tools to extract them or a laser to break them into smaller pieces. This minimally invasive procedure is often used for stones located in the lower urinary tract. Percutaneous. Nephrolithotomy, for very large stones. Percutaneous nephrolithotomy, PCNL, is a surgical procedure used to remove very large or complex kidney stones. A small incision is made in the back, and a nephroscope is inserted directly into the kidney. The stones are then broken up using ultrasonic, laser, or pneumatic energy and removed through the scope. PCNL is typically recommended for stones that cannot be treated effectively with ESWL or ureteroscopy due to their size or location. Preventative medications. Thiazide diuretics reduce calcium levels in urine. Allopurinol for uric acid stones. Citrate to prevent calcium stones. Home remedies and lifestyle changes. Hydration. Drink water, at least 2 to 3 liters a day. Lemon juice can help prevent stones. Apple cider vinegar contains acetic acid, which helps dissolve stones. Dietary adjustments. Limit oxalate. Rich foods. Spinach, beets, nuts. Chocolate. Reduce sodium intake. Moderate protein consumption, especially animal proteins. Get calcium from food rather than supplements. Herbal remedies. Chanca piedra, known as the stone breaker. Horsetail juice, a natural diuretic. Physical activity. Regular exercise. Helps maintain a healthy weight and reduce stone risk. Monitoring and follow-up. Regular checkups, especially if you have a history of kidney stones. Stay informed about your specific risk factors and prevention strategies. Kidney stones are a common but painful condition that can often be managed and prevented with proper care and lifestyle changes. Understanding the causes, symptoms, and treatment options is crucial for effectively dealing with kidney stones. Remember, staying hydrated, making dietary adjustments, and seeking medical advice when necessary are key to preventing and managing kidney stones. Ready to take control of your kidney health? Don't let kidney stones hold you back from living your best life. Subscribe to our channel for more tips and advice on managing kidney stones and maintaining overall kidney health. Let's work together to keep your kidneys healthy and stone-free.